Okay, the question is that many of you have glaucoma, and many of you came here with people who do have glaucoma. Now the question posed is, who gets glaucoma?
Hi everyone, my name is Noelle Pruzan. I'm another one of the glaucoma fellows at Wills Eye. Thanks for being here. So I know we just heard about an exciting treatment for glaucoma, but we're going to go backwards a little bit and try to answer the question, who gets glaucoma? And the answer is anyone. Anyone can get glaucoma. People who are old, people who are young, people of all races and ethnicities, men, women, people who have lots of other medical problems, or people who are otherwise perfectly healthy. However, there are certain populations that are at much higher risk of developing glaucoma, and so we're going to talk about a lot of those risk factors today. To start, I wanted to talk about the scope of glaucoma. Glaucoma is a significant public health problem worldwide. It was estimated that in 2010 there were 60 million people in the world with glaucoma, and it's estimated that in 2020 that number will rise to almost 80 million people in the world. About 3/4 of those people have the type of glaucoma called open-angle glaucoma, and the other quarter of those people have the closed-angle glaucoma type. About 10% of those people are estimated to be blind, and that makes glaucoma the second leading cause of blindness in the world. That's 6.6 million people who are blind from glaucoma in the world. Just to go back and discuss the two main types of glaucoma, Dr. Amanlari discussed this, but I'm going to be talking about risk factors for these two types, so I just wanted to review. The more common type of glaucoma is open-angle glaucoma, and that's the kind of glaucoma where there's a wide open angle between the iris, which is right here, and the cornea, and there's access to the drainage channel, but it's thought that the drainage channel is blocked, and so the fluid in the eye can't get out of that drainage channel. It's estimated that about almost 2% of people worldwide have this type of glaucoma. The other type of glaucoma is closed angle or angle closure glaucoma, and that's when the angle between the iris and the cornea is closed and there's no access to that drainage channel. And about 0.7% of people worldwide have that type of glaucoma. So now we're going to focus about glaucoma specifically in the U.S. Almost 2% of adults over 40 have glaucoma in the U.S. That's 2 people out of 100. And that equates to 2.7 million adults in the U.S. currently affected by glaucoma, which places glaucoma about third in the list of common eye diseases in American adults, right after cataract and diabetic diseases in the eye, and a little more common than macular degeneration. So this is going to be our main focus for this talk, the risk factors for glaucoma, and I'm going to go through a bunch of these in more detail. And we'll start with high eye pressure. So as Dr. Amanlari said, if you have higher eye pressure, you are at increased risk for glaucoma, but this isn't the whole story. Some people can have higher eye pressures than average and never develop glaucoma because their optic nerves can tolerate that pressure. Other people can have quote-unquote normal or average pressures in America and they can still get glaucoma, and that's because their optic nerve can't tolerate that pressure, and that's what's called normal tension glaucoma. So even though we know that intraocular pressure, or eye pressure, high eye pressure, is a big risk factor for glaucoma, it's not the whole story. We do know, though, that lowering eye pressure can decrease the development of glaucoma and decrease the progression of glaucoma, and it is the mainstay of all of our treatments. So now we'll talk about age in glaucoma. Older age is an increased risk for glaucoma. It's thought that glaucoma prevalence increases to 3 to 8 times higher in people in their 70s compared to people in their 40s. And in fact, people who are 75 and older, about 10% of those people have glaucoma. So almost 1 in 10 people over the age of 75 has glaucoma in America. This is a graph of different races and the prevalence of glaucoma with age, and you can see that in all of the races, as people get older, the prevalence of glaucoma increases. And this is especially the case for African Americans and Latinos, where having an increased age is an even higher increased risk for glaucoma than in other races. Increased age being a risk factor for glaucoma is the case for both open-angle and closed-angle glaucoma. With closed-angle glaucoma, it's felt that the anatomy of the eye changes with age, and a lot of that has to do with developing cataract, which takes up space in the eye and makes there less space in the front of the eye for access to those drainage channels. So now we're going to talk a little bit more about race and risk factors for glaucoma. African Americans have a 3 to 4 times higher prevalence of open-angle glaucoma compared to whites. And they also have a worse disease. They have a 4 to 10 times higher risk of blindness with glaucoma, and it's the leading cause of blindness in African Americans in America. They can also develop glaucoma at a younger age and have a more severe type. So this is a very important risk factor that we take seriously. More recent studies have shown that there's a similarly increased risk in Latino populations. Now, Asians comprise almost 50% of all glaucoma, and almost 90% of people with angle closure or closed angle glaucoma are in Asia. Chinese populations are felt to have a higher risk of this angle closure glaucoma, whereas Japanese populations are found to have a higher risk of the normal tension open angle glaucoma. And the risk of glaucoma really varies by age. The Inuit populations in the Arctic are felt to have the highest known prevalence of angle closure glaucoma, with a 20 to 40 times increased risk of this type of glaucoma. All right, now we're going to talk a little bit about family history and glaucoma. If you have family members with glaucoma, especially first-degree relatives, meaning parents or siblings, you have an increased risk of having glaucoma. And again, that's the case for both open-angle and closed-angle glaucoma. Interestingly, this doesn't seem to be a risk factor for the progression of glaucoma, just the development of glaucoma. Now, the estimates of the exact risk of having a family member with glaucoma varies, but it's felt that if a first-degree relative of yours has glaucoma, then you have about a 5 to 15% risk of developing glaucoma. So it's an important thing to ask your family members and have in mind when you come in for screening or when you decide whether it would be a good idea for you to have screening. Because we were talking about family history and glaucoma, I thought it would be a good time to segue into genetics and glaucoma and talk a little bit about that. So there are major gene defects that are known to cause glaucoma in specific individuals. However, most cases of glaucoma do not have an identified genetic abnormality. And really, it's felt that there are many genes involved and that there's a complex inheritance of these genes, as well as a complex interaction between genetics and environmental factors. So there's still a lot more work to be done in this, and there's a lot of active research going on in this field. Another risk factor I wanted to talk about was gender. With open-angle glaucoma, the studies have been mixed. Some studies have shown that men are more likely to have it. Some studies have been shown that women are more likely to get glaucoma, and other studies have shown that there's no difference. So generally, it's felt that gender is not a risk factor for open-angle glaucoma, but I think the jury's still out on that one. With closed-angle glaucoma, women are at increased risk. Women actually comprise about 60% of glaucoma patients worldwide and 70% of angle closure glaucoma. Now, why is this? A few reasons. One, there's more women in the world. Two, women live longer, and as we talked about, age is an important risk factor for glaucoma. And three, regarding closed-angle glaucoma, there are anatomical differences of the eye where, in general, on average, women have smaller eyes, and so that angle that we spoke about is more likely to be crowded, which is why women are a little more likely to have the angle closure type of glaucoma. So a few more risk factors that I want to go through and mention. With open-angle glaucoma, being myopic or being nearsighted is a risk factor for glaucoma, and the mechanism there is that it's felt that the wall of the eye might be a little more thin, which increases the risk of damage to the optic nerve. With closed-angle glaucoma, being hyperopic or farsighted is an increased risk, and that's again because of the anatomical changes of the eye in people who are farsighted. They tend to have smaller eyes, and that angle where the drainage systems are tends to be more crowded. There are some medical conditions that can increase risk for glaucoma. With diabetes, again, studies have been a little bit inconclusive, and so we're not totally sure how much or if diabetes increases the risk of glaucoma. With blood pressure, it's thought that having low blood pressure increases your risk for glaucoma because of a decreased blood flow to the optic nerve. However, studies have also shown that high blood pressure can increase risk, so perhaps having average blood pressure might be the lowest risk for glaucoma, and that high and low blood pressure might increase risk through different mechanisms. Other studies have shown an association between migraines and normal tension glaucoma, which is another thing that Dr. Almanlari mentioned, and they think there that something is related between the spasms of the small blood vessels in the body. There are many different eye conditions that can increase risk for glaucoma, including cancer of the eye, retinal detachments, and eye inflammation, all of which can lead to glaucoma. When you come into the glaucoma clinic, oftentimes they'll check the thickness of your cornea. And the reason we do that is because studies have shown that having a thinner cornea is an increased risk for glaucoma. In addition, the thickness of the cornea can affect the intraocular pressure measurement that we get on the eye, though there's been no accepted normogram to really correct for that. But it is something that we check and include in our list of risk factors about each person that we see. Certain medications can increase the risk for glaucoma. Many medications can increase the risk for angle closure, as Dr. Amanlari mentioned, and steroids can increase the risk of increasing your eye pressure and in developing glaucoma. So, in conclusion, there are certain risk factors that can predispose a person to develop glaucoma, the most major of them being age, race, family history, and regular screenings are critical for those with risk factors so that we can pick up if someone has glaucoma. As Dr. Amanlari mentioned, a lot of times there are no symptoms to this at all, and so it's important to identify your risk factors and see whether you're someone who should be checked out. And as the number of people with glaucoma rises, awareness and early diagnosis is increasingly important. Thanks very much.